Hi and welcome to this screencast. Dennis Otundo here. This is part 2 of the case control study series, and we will be looking specifically at the limitations of the case control study design. So we have 5 limitations to this design. Number 1, that the choice of the control group affects the comparison between the cases and the controls. Number 2, that the exposure to the risk factor data is usually collected retrospectively and may be incomplete, inaccurate, or biased. Also, number 3, if the process that leads to the identification of the cases is related to a possible risk factor, interpretation of the results is usually a challenge, and this is at times referred to as the ascertainment bias. So, for example, suppose that the cases of young women with high blood pressure recruited from a contraception clinic are recruited into a case control study design. So, in this situation, a possible risk factor that the oral contraceptive pill is linked to the recruitment of the cases, and so the oral contraceptive use may be more common among cases than population controls for this reason alone. So the fourth challenge that we have with the case control study design is that the time-cost relationships need careful interpretation, since changes in biological quantities may precede the disease or be a result of the disease itself. For example, maybe a raised serum troponin level is associated with myocardial infarction, but is only raised after the event. So therefore, a case control study may find that high troponin levels are associated with myocardial infarction, but this cannot in fact be a risk factor. So last but not least, the risk estimates for exposures cannot be estimated directly because the case and control groups are not representative samples of their respective target population, and so estimates of the risks are biased. So this has implications for the statistical analysis and then the interpretation of the results. And risks are usually estimated using odds and ratio of odds, and this only approximate to risks and ratio of risk when the disease under investigation is rare. And also it's good to note that this limitation can be overcome with certain designs. For example, where a case control study is nested in a cohort study where all the cases and controls are identified prospectively and a truly random sample of control is available. Shortly we'll be looking at the cohort studies, and we'll discuss this further. And in this situation, the relative risk can be calculated directly. So thank you for keeping it here. Let's discuss about cohort studies and also their advantages and disadvantages next. Thank you.